Yeah.
My name is Professor Raman Bedi, and I am here to give a short summary of the webinar that the World Federation of Public Health Associations undertook recently. The webinar is on silver-diamine fluoride transforming community dental caries programs, and it occurred on Thursday, October the 10th, 2019. The full webinar is almost 90 minutes, and the purpose of this short summary is to highlight the take-home messages. Next. The webinar from the All Health Group is one of a number that are being undertaken, but we do want to identify our key sponsors: the University of Geneva, the charity, the Global Child Dental Fund, and Colgate-Palmolive. Next. My name is Professor Raman Bedi. I was the Chief Dental Officer for England and am currently the Chairman of the All Health Working Group. Next. We had 4 international speakers, and I was delighted that they all agreed to participate. Professor Richard Needleman is at NYU and has undertaken one of the largest studies on silver-diamine fluoride in the New York region. Professor C.H. Chu is at the University of Hong Kong, and the University of Hong Kong have a very strong research team looking at silver-diamine fluoride, and they have undertaken one of the largest kindergarten studies to show improvements in child oral health. And in fact, now they're doing that throughout the country and throughout the island of Hong Kong. Jeff Knight is one of the originators of silver-diamine fluoride and has been a clinician working in Australia. Jeff brought together the experience of Australia and particularly the radical improvements in oral health in the state of Victoria. Dr. Prateep Panatumvanit is the Dean at Thammasat University, and Prateep was the pioneer of what is now being used as the silver ART. Next slide. Rick Needleman highlighted that silver-diamine fluoride in community programs brings about management and a reduction in the inequality in oral health. Inequity in oral health terms for young children has been a historical challenge for the profession. Very few initiatives have managed to address this inequality, and what Rick was able to show is that with silver-diamine fluoride, that we are seeing a reduction in inequalities in oral health for very young children. He was able to show also the cost benefit of silver-diamine fluoride as opposed to the traditional care provided in community programs, or in fact, the prevention of general anesthetic and dental extractions. Next slide. Prateep Panatumvanit was able to show how using silver-diamine fluoride and then the placement of glass ionomer was much better than just using glass ionomer alone. This has now become the silver ART, the atraumatic restoration, or as our North American colleagues call, the interim restorative technique. So silver-diamine fluoride now is an essential part of placement in young children on primary teeth before the placement of glass ionomer. Next slide. C.H. Chow showed in Hong Kong how using silver-diamine fluoride for kindergarten children had produced a significant reduction in new cavities, prevention of pain and sepsis, and was so successful that the community themselves have rallied around the university and now have encouraged them to do it throughout the whole of the island. Next slide. Jeff Knight showed us from Australia how there had been almost a complete reduction in the number of children needing a general anesthetic and dental treatment. He was also able to show how there was a reduction in pain and sepsis, and silver-diamine fluoride was transforming the community approach to dental care for children. Next slide. So what were the take-home messages from this webinar? First of all, silver dynamine fluoride should be a part of any outreach dental program, especially for young children. Traditional programs of toothbrushing or fluoride varnish should be supplemented with a strategy that weaves in silver dynamine fluoride when cavities are present. The Hong Kong research team has shown us that kindergarten's project was that children and parents received the silver dynamine fluoride enthusiastically and well. It reduced the number of new cavities, it reduced the number of children with pain and sepsis, and had radically transformed oral health care for that group. To such an extent, they have now received one of the largest grants the university have received for a dental project, and they have been encouraged to go throughout the whole nation, throughout the whole island. So silver dynamine fluoride reduces pain and sepsis. So in cavities in young children, the SDF is a way of making sure that there is no progression of dental care and hence no pain or sepsis. If SDF is applied early when the cavity is present, then there will not be any irreversible pulp damage. What the Hong Kong study showed us, and also the Australia examples, was that SDF attracted community support. And they engaged with parents who do not traditionally take their children to the dentist. In many parts of the world, children as age of 2 years old do not go to the dentist. And in this approach, we were able to engage with parents and then encourage them to take their children to find a dental home. Jeff Knight was able to show us in the state of Victoria that they called this the dental vaccination scheme. So dental vaccination was there and parents understood the term, understood the importance of vaccination. And of course, the vaccination concept is that the teeth are strengthened, more resistant to decay, and hence in every term could be called the dental vaccination scheme. Prateep showed us that silver ART is an attractive alternative to the ART restoration. He showed the reduction in the recurrence of pain or progression of decay, and that the technique was relatively simple to undertake. I hope you are able to watch the full webinar and to see the evidence and the presentation by our speakers. Thank you very much. And I just want to, next slide, just make you aware of upcoming webinars. On the 17th of October will be the daily toothbrushing as part of school-based education curricula. And then on the 15th of November, the importance of integrating general and oral health. In 2020, the World Federation of Public Health Associations Oral Health Working Group will produce a whole new series of global webinars. Thank you very much.